So in people who have hemophilia, they lack these clotting factors.
Hemophilia is a rare inherited blood disorder that causes blood to clot less and results into an increased risk of spontaneous bleeding or bruising. It is a mostly inherited genetic disorder that impairs the body's ability to make blood clots that can also result into bleeding and bruising after surgery or other injuries.
That this has been a condition that Ministry of Health had not come out really to do big awareness.
The condition tends to occur mainly in males because they have one copy of the genes which causes a recessive change in the X chromosome. However, there are only few people who are aware of the condition due to its limited sensitization.
Most of these disorders are hereditary, and therefore if interventions are not made early, we are likely to have more and more cases.
Majority of these patients have gone to traditional healers thinking they are bewitched, but it is not anything to do with witchcraft. It is a condition we are living with, and we have not taken effort to support these patients.
Apparently, the Hemophilia Foundation of Uganda registers over 500 patients who seek free medical care in hemophilia.
We have realized that the number of patients is quite big because we are looking at the prevalence of one in 5,000 births. So we expect to have over 4,600 patients in Uganda looking at our population, but how many have been identified? So
the condition, although hard to detect, sometimes presents signs like nosebleeds, blood in urine, blood in stool, bleeding from the mouth and gums, bleeding after circumcision, among others. Hemophilia can be treated through replacement of missing blood clotting factor so that the blood can clot properly, and this is usually done by injecting treatment into a person's veins.
Probably several cases across the country, but to date we've only been able to diagnose about 400 out of about 4,000 to 5,000 patients.
This year is World Hemophilia Day 2024, held at the Paramedical School Mulago Hospital, as commemorated under the theme Equitable Access for All, recognizing all bleeding disorders. Susan Naonga reporting for EBC TV.